Do you worry about choking? Do you worry about dying from an obstructed airway? How do you help yourself? How do you help others? Good morning, Professor Teresa White and other faculty members of Columbia Southern University. My name is Brian Wong, and today I'm going to give you information on how to help yourself and how to help others when it comes to an emergency from choking. Without helping yourself, you could die due to lack of oxygen. As for my training as an emergency medical responder and as a first aid instructor, today I decided to give you information on how to help others and yourself when you're choking. When it comes to an emergency situation, first we want to identify what happened. We want to identify, is there safety in jeopardy? How many people are injured? What exactly happened here? Followed by activating emergency medical services, EMS, also known as 911 in typical areas. In those situations, after that is all completed, which typically takes no longer than 30 seconds. For us, afterwards, we want to identify the person, checking the scene, making sure that everything is safe. Now this person is conscious, they're choking. I want to identify, hey, you're choking. They're going to simply nod their head. So keep coughing, encourage them to cough. Cough until they can't cough anymore. So keep encouraging coughing. With this step, it allows us to do less work once they can cough. If they can cough, it makes our life much easier as a first responder. Keep coughing. Now that they stop coughing, they can't cough anymore. So now we have what is known as an airway obstruction. We're going to go behind this person, put our chest right up against their back, our hands right to the belly button, make one fist, make one hand, and then motion goes inwards and upwards in a J motion, with using enough force to get them up onto their toes. Within a J motion, we do this up until either they go unconscious or the object comes up. So here goes unconscious. So now that my patient's gone unconscious, my first key is make sure 911 has been called. If that hasn't been called, hey you, go call 911, tell them we have an unconscious patient who isn't choking. Do you understand? And report back to me. Okay, now I've activated my 911 now. Next, first I'll put some protection on for myself. My patient doesn't want whatever infections I have, nor do I want what they have. As another protective barrier for me, have a pocket mask, which allows me to ventilate to the patient. Hey, can you wake up? Can you hear me? No response. I'm gonna check the airway. Look in the mouth, don't see anything. Head tilt, see if I feel a breath. 10 seconds goes by, I don't feel a breath. So if I don't feel a breath, I want to check to see if the airway is open by giving a breath. Doesn't go in. Gonna readjust the head, tilt it back down, tilt it back up. Air still doesn't go in. So now I know the airway is blocked because I can't get air in. Fingers on center of the chest, hands on top, and 30 compressions. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 10. 1 and 2 and 3 and 4 and 15. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30. Look in the mouth. Hey, I see an object. Hook it out, put it beside them. Now that we know that you've got the object out, let's give a breath and see if the airway is clear or not. Air goes in. Don't need to readjust, just give a second breath. Second breath goes in. So as you can see the chest rise, tells me you have an effective flow with air going in. Now the air goes in, my airway's clear, and now I can move on. I've completed that. If in a situation where air doesn't go in, we will complete that cycle once again by compressions and then checking the mouth and then ventilations. So that's the gist of how to help a person when they're choking. Now, I'm going to teach you how to help yourself in a situation where you're choking. In a situation where you're choking, you're going to help yourself by using a chair or any kind of furniture with a firm surface that is solidly, firmly on the ground. Now that I'm choking, which is a universal sign of distress, hands usually go to the throat, trying to help myself, and then what I'll do is I'm going to run myself into the back of the chair, right into the stomach area, to force the air up to help get the object out. I'm going to keep going for once or twice. If that doesn't help, what I also can try, make a fist, hand on top, motion inwards and upwards. Same thing you did with your partner earlier, or the patient earlier, inwards and upwards, up until either I go unconscious or it comes up. Hopefully, you don't do it for that long. Our goal is to say do it once, twice, max 3 times. But make sure in this process you activated 911 EMS. Because if you don't, who's going to find you? Who's going to help you? So you want to make sure you call 911, go outside the front door, get to the front lawn, and get where you can be seen. This way, when the responders come, they see you, they can help you immediately. So that helps you how to help yourself. So in conclusion, I've covered up how to help yourself, how to help others. When it comes to a conscious person who's conscious and choking, we want to encourage them, keep coughing, until they go unconscious. Once they go unconscious, we must ensure 911 has been activated. Followed by a visual check in the mouth. Can't see anything? Give a breath. Breath doesn't go in. Give a second breath. Doesn't go in. We then start compressions. After that, if air goes in, tells me the airway is clear. But I must also see the chest rising because it tells me I have an effective flow. If I'm alone, back of a chair, or use my hands. Most importantly, call 911. So when it comes to a situation where someone ever asks you the question, do you worry about dying from choking? What can you answer now? Now I can tell them, I'm not going to worry, because I have a brief introduction to how to help others and myself. Same goes for the other question. Do you know how to help others? Now you can say, I can, until someone higher qualified to help is arriving. One thing I want to keep in mind for this presentation is this just gives you brief information on how to help others and how to help yourself. It does not provide any certification, but gives you brief knowledge.